Hello, I'm Becky Barney. I'm a Child Teaching Fellow.
My name's Sarah Clements. I'm a children's nurse and a teaching fellow.
Hello, my name's Lawrence Drew. I'm the field lead for mental health nursing here at the University of Surrey.
Hi, I'm Lizzie Crowhurst and I'm one of the teaching fellows at the School of Health Sciences and I'm a nurse.
I'm Elizabeth Barley. I'm Professor of Mental Health Sciences and Nursing and I'm an adult nurse.
Hello, my name is Vicky Saravia and I'm a midwifery teaching fellow.
Hello, my name is Jen. I'm a second year student midwife.
Hi, my name's Amy Dobson and I'm one of the two heads of Department for Education within Health Sciences. But first and foremost, I'm an adult nurse and I'm a children's nurse.
My mum bought me my first nurse's uniform at the age of 3 and I never looked back.
I am incredibly proud to be a children's nurse. What inspired me is that I just knew that I always wanted to work with children because they've got this zest for life and they just bounce back, and so having the honour to work with them and their families when they're poorly and vulnerable has just been phenomenal.
I always knew I wanted to be a nurse. My mum is a nurse and growing up around her, she used to tell me some really inspiring stories about her nursing career that really instilled that interest and that spark.
I wanted to become a nurse to help people with their mental health needs, but particularly men. For some men who perceive themselves as tough, they find it difficult sometimes to acknowledge their feelings and to admit that it's okay to not be okay.
When I first went into nursing, I primarily wanted to work with people, but I was also looking for a career that was going to be interesting and challenging.
What I really love about midwifery is the diversity of the job. There's something really special about being able to support, educate and empower women and be there at the birth of a new baby and a new family.
The fact that I get to meet a variety of people and I get to learn about their story. I love hearing different people's narratives and finding out what's important to them.
Being able to build that relationship and have a rapport with women throughout their pregnancy into the postnatal period is honestly one of the most rewarding feelings.
Human connection, compassion and kindness were the reasons I started nursing, and I'm now in the amazing position to be able to use my experiences to support the next generation of nurses.
Working now as an educator, I have the opportunity to share my knowledge, my skills and my experience and the lessons that I've learned with the future generation of midwives, and that feels really special.
I'm really proud now to work at the university and support students as they become children's nurses.
Here at the University of Surrey, we take an active role in our students' learning journey and empower them to make a real difference in their patients' lives.
Happy International Year of the Nurse and Midwife.